I've been excited about our next interview and our next guest for some time. So excited I've been saying his name wrong. I've been calling him Paul. His name's actually Ryan. Ryan Smith joins the show this morning. Ryan is a listener of the Murphy Show. He heard about the Envoy Medical Esteem hearing implant procedure. I guess last year, we were talking about it around this time last year. And he heard about it and made a call, and we'll talk to him this morning about his experience and his life experience with hearing and how it has been changed through the Envoy procedure. We welcome to the show Ryan Smith. Ryan, good morning.
Good morning, Matt. Good to be here.
Nice to have you here. It's kind of cool. You're a school teacher.
I am. I teach at Hueytown High School.
I used to love U.S. history, and I'll tell you why. Because unlike all of the other kids hated the dates and stuff. For some reason, I had a knack to remember it, so I could remember that Lincoln was shot on April 14th, 1865. I can remember. Nice. I could remember I could remember all of those things, and so I loved U.S. history.
It is a lot of fun when done right. Yeah, it can't be just trivia, but if you can tie it into modern day stuff, kids just eat it up.
How can you get all of it in? Because even when I was, we never got to the Vietnam War.
Really?
No,
it's such a minor event. Who cares about that?
No, we got stuck on World War II all the time.
Right, that's true.
It's good to have you here. You teach at Hueytown?
Hueytown, yes, sir.
How do you like it?
I love it out there. It's a lot of good people, good place, great administration, very supportive, great place to work.
Before we talk about your experience, or actually, I'll tell you what, I'm going to let Dr. McFeely hold while I work up to his involvement in the situation. You have hearing loss.
Yes, severe.
Has it been a lifelong situation, or did it happen at some point during your life? Or
we knew something was wrong when I was in elementary school. I got tested at 25% hearing loss in the 4th or 5th grade. By the time I got out of high school, I had lost about 45% of my hearing. And by the time I got out of college, it was up in the mid-60s range. So I'd had hearing aids for 20 years. And they can only do so much for you because they're a teeny tiny device. The smaller they get, really, the less they can do for you. So when I got my teaching job, it was difficult in the classroom because you can watch that sound fade out. You can watch letters disappear from kids' words like the ST sound, the CH, SH, stuff like that, little soft sounds. Mm-hmm. You can hear the main vowels that kids are saying, but you're not real sure what the word is. So you have to do a lot of word association and hope that you guessed what they said correctly. And so sometimes a student will say something or any conversation, somebody says a word and you think you heard them right and you respond and they look at you like, what the heck are you talking about?
Right.
I wasn't even close to that. So it's a tough field to be in when you can't hear very well.
Well, I was about to say, I remember, I don't live around 10th and 11th graders like you do, but I remember being a 10th and 11th grader and you know what? The kids see a situation, maybe sometimes take advantage of it, or
oh my!
And I can imagine it was a rough world to live in.
I've been the butt of more than one joke, yes.
So you heard about it on the show.
I did, yes.
And you were inspired to just inquire about whether or not you would be a candidate.
Yeah. You kept saying that Blue Cross Blue Shield might possibly pay for it. So I gave them a call, and they offered to pay for it in full. And, you can't pass up an offer like that. You got to at least try it if somebody else is paying for it.
No doubt.
So we made the phone calls. I went to Huntsville to see Dr. McFeely, ran a few tests, and a couple of months later had me on the table putting this thing in.
Ryan Smith, our guest, talking about his experience with Envoy Medical. And speaking of Dr. William McFeely, he joins us on the Murphy Show this morning to give his input into Ryan's situation and to talk about the Envoy Medical procedure known as Esteem. Dr. McFeely, good morning.
Good morning, Matt. How are you?
I'm doing well. Good to speak with you again. And I imagine you remember this patient of yours, Ryan Smith?
Oh, yes, I do. Hi, Ryan. How are you?
I'm doing great, Doctor. How you doing?
Good, good.
Doc, this is probably old hat for you. For me, it's a wonderful experience to get to talk to people like Ryan. But this is something that you're doing, if not on a daily basis, on a very regular basis, helping people through the incredible procedure that Envoy Medical is designed to hear better.
Yes, it really is a major breakthrough in the treatment of hearing loss. And it's just so nice to be able to offer this to people like Ryan, and we've had a great deal of success here in Huntsville with it.
Doctor, just from the technical side of things, help us understand how this works. Ryan mentioned the hearing aids. That's pretty much, it's been the same technology. I'm not knocking hearing aids. It's a wonderful thing for people who need them, who want to just be able to hear a little bit better. But that technology really hasn't changed over the years. How is this a game changer?
Yeah, this is very different. This really is a treatment for hearing loss when people have failed hearing aids. And yes, hearing aids have improved in many ways, but people still have a great deal of difficulty with them. There's a lot of patients that are dissatisfied with hearing aids when appropriately fit by an audiologist. Most people really do well, but there are a number of patients that would be willing to look at something else. And the Esteem implant is really, it's not a hearing aid. It's more of a prosthetic where the implant can help a person's body help itself, that it takes sound from the natural structures of the ear, including the ear canal, eardrum, and first and second hearing bones, and then it amplifies those signals, those sounds internally with an implant inside and sends those amplified sounds directly to the third hearing bone and the inner ear from there. So it's a different, fully implantable or surgical solution for people that have nerve damage or nerve hearing loss and have failed other types of treatment.
How common is the type of hearing loss that we're talking about? Because I know I always say when I'm talking about Esteem that it is for, like in Ryan's case, his type of hearing loss. Is it a fairly common type?
Yes, actually, it's very common, especially with the amount of noise people are around these days. And there's an awful lot of people that potentially would meet the criteria for this implant. Not that everyone needs it or would want it, but it is a nice option for those that would consider that. And it's really for people who have a moderate to severe sensorineural or nerve type of hearing loss, and again have failed other types of treatments. And you have to have hearing loss in both ears to potentially qualify for this implant.
Well, I tell people all the time, Dr. McFeely, and I'm not trying to make light of it. Actually, Ryan just pointed at me and pointed at my headphones. I'd say that I'm probably going to be a future envoy candidate with my job because I've got these headphones on every day and they're cranked up real loud. So hopefully I won't be seeing you in the near future, Dr. McFeely, but I'm glad to know you're up there.
Yes, happy to help if you have troubles or any of your listeners do. I'm always happy to offer an opinion about treating hearing loss.
Well, I'm going to talk to Ryan in a couple of minutes about his individual situation with you and his experience working through the process. But I'm curious, from your side of things, I mean, what is the process? I mean, is it just as simple as a visit to you or to an audiologist to see if your type of hearing loss would qualify?
Correct. An audiologist certainly can do the testing. I would be happy to review test results and see if someone is potentially a candidate. And again, I always encourage an evaluation if people have just failed their other types of treatments. And sometimes we come up with other solutions or other surgical options that maybe people didn't even think about. So, I offer a wide variety of treatments for hearing loss, but this truly is a life-changing breakthrough, and I'm just so happy to be able to offer that to our patients here.
Well, let me tell you, Dr. McFeely, we're pleased that you're in the state and that we have you around. I mean, we're unique in the fact that, you can't get this in every state in the union. You can't get a doctor like yourself performing this procedure everywhere. It's a specialized technique, and we're just so very appreciative that you're here in Alabama offering the service.
Yep, happy to do it. And again, Birmingham's not particularly far for patients there to make their way to Huntsville. There are other doctors in the country doing it, but I would represent the closest physician for that. And also, I'm within the network for Blue Cross for those who have that type of insurance.
Yeah, and it should be noted that if you have, I mean, you need to ask about that. I mean, Ryan made mention of it. If you're covered under certain plans are going to offer you coverage, and that's just an incredible incentive to inquire further if you are frustrated with hearing aids or you believe you do qualify.
Correct, and again, this is really exciting. Option that is FDA approved and, again, has tremendous lifestyle advantages to it. So it's definitely worth considering for a number of people now.
Well, Doc, I appreciate you being on the phone with us. I'm going to talk a little bit with Ryan about his case and his experience, but I don't want to hold you up. I know your time is very valuable, but I thank you for everything you do for the state of Alabama and everything you do for the Esteem Hearing Implant, and hopefully we'll get folks calling you and inquiring further about potentially how you can help them in this life-altering surgical procedure.
Yes, thank you so much. I really appreciate it, man.
All right, take care. Thanks again to Dr. McFeely on the show with us just a little bit, talking about Envoy Medical and the Esteem Hearing Implant. Brian Smith, our guest, and we got a couple of folks that want to call in or want to talk with you at 944-1070, 866-927-1070. Before we do that, however, just walk me through. You mentioned you had about 25% loss
in elementary school.
In elementary school, 45% in high school?
Yes.
Both ears?
Both ears.
Did you notice that your hearing was going away, or was it something that happened so slowly over time that you really it was something you didn't notice?
I had no idea what was going on. I knew that something was wrong. I was missing a little bit. I just thought my friends were being very secretive. Thought they were had really bad country accents. I grew up in the woods outside of Mobile where everybody talked like molasses or something. So I just assumed they didn't speak right. It was always somebody else's fault. And, hey, why aren't you speaking right to me? Playing football in high school, you have a 6'5", 230-pound tight end. Should have done something, but I could never hear the plays. So eventually my coaches just gave up, and every play was, all right, go block the strong safety. For real?
Yeah.
So it slips away so fast or so slowly that you don't realize it's going away. You convince yourself that certain sounds never existed, but you know good and well they're there. But you just convince yourself, those crickets aren't really that loud. The cicadas aren't really in the trees. That instrument note didn't really exist in the song I used to think it was in. And you play mind games to make it to where you're okay and everybody else has the problem.
Are you married?
Yes, I am.
Children?
3. Working on 4.
How long have you been married?
Been married since 98.
So you obviously had hearing aids at the time that you got married.
Yes.
Has this changed your relationship with your wife? Your wife has to be just absolutely elated. I don't know any other way to put it. Has this just changed that dynamic?
It really has. We can communicate across the house. I can talk to the children. I can talk to the kids in the van while we're on the interstate now with the radio on. Whereas before, with the hearing aid, you get one sound, and it channels everything else out. It thinks it's protecting you from the world and protecting your hearing. Mm-hmm. And what it does is it blocks out anything that little machine doesn't want you to hear. So if it's a kid in the back seat whining about something, crying about something or talking, being a happy child, you don't know. The road noise disappears, so my wife will say, "Can you hear that noise coming from the engine?" "No, baby, the car sounds fine." Now we can talk from anywhere. We can... At night before we go to sleep, I can talk to her without my hearing aids whistling because a pillow's covering them up or whatever. I wake up in the night when the kids get up because my hearing never turns off. It's a whole different world.
You have a remote control, too.
I do.
Isn't that cool?
Right? Yeah.
I don't know why. I talked to another lady, Susan Davis, about this, and she brought in a remote control. This is last year. We talked to Susan, and I don't know why, but I just thought that was the coolest thing, that you have a remote control. Literally, I don't know about you, but, if the kids get rowdy, you hold it with the remote. Hey, I'll turn this down, turn y'all off.
Shut them off. Or if the wife gets no. She may be listening. I won't
Watch out now. Be careful. Morgan is on the line, who wants to say hello to Ryan. I bet Morgan knows Ryan. Hello, Morgan. Good morning.
No, this isn't Morgan. This is Morgan's granddaddy. This is Wilson.
Oh, this is Wilson. My apologize, Wilson. Go right ahead.
Yes. Mr. Smith, my granddaughter goes to Hueytown. Her name is Morgan LaFoy.
Okay.
And I'm sure she's probably either had your class or going to be in. But her mother is also a teacher in the system. Her name is Kimberly LaFoy. She teaches at the middle school.
Oh, okay.
And I have never experienced hearing loss, but members of my family have. And I can only imagine what a world you woke up to one day.
Yeah, and it's kind of what I was about to go into, Wilson. You beat me to the punch there. I'm curious, and you don't look like the type of guy. Ryan is like you mentioned. What are you, 6'5"?
Yes.
Tight end in high school.
Right.
So you don't look like and thanks, Wilson, for the call. You don't like too much of a sentimental guy, but walk me through the experience of having these things turned on and the difference between what you heard before and the day that that you heard with this type of clarity?
Okay. Well, we went in November 9th to get the implant put in. The surgery, you're down for 4 or 5 hours. I mean, they're drilling on the side of your skull, not all the way through, but they have to flatten out a place to glue this thing to the side of your skull. There are two little drivers, they call them, that connect to the actual bones in your eardrum. The first one and the third one. They sew your head up, they send you home, you're completely deaf on that side for 8 weeks. And then when it's turned on, it is excruciatingly loud. But at first, they turn it to the lowest level possible out of 15 volume levels.
Uh-huh.
And when that baby comes on, it's like, oh my gosh, what have I done? It sounds like a firing range in here or something. We got in the car, we're on the way home, and I want to say this is a secret, don't tell anybody, but that's kind of blown being on the radio. We're listening to songs that I grew up with, songs that I had forgotten about sounds. And I'm asking my wife, what is that noise? Well, honey, that's a hammered dulcimer. What is that noise? That's a piccolo. I had no idea. And there's not a dry eye in the car. Everybody's crying because of what Daddy can hear now. And it's like relearning life all over again. I would hear something in the yard, and I'd call my wife, come here, what is this noise? And we'd all run out. She's like, oh, that's a squirrel scratching on the tree. You got to be kidding me. I've never heard that before.
Wow.
The kids have a good time with it, too. It's kind of like, what is Daddy here today or something. It's like a little game. It's a lot of fun for the whole family.
So you had the first year done. You do the years at separate times.
Right.
Just to make sure that everything goes well in the procedure, because it is a surgical procedure, and I try to remind people that. I mean, we're talking about surgery, so complications exist or could exist, so you want to do one at a time. And you had the second year done this year?
Past May.
And when did you get it turned on?
I got it turned on in the middle of July 24th, something like that. So it's less than a month old for me.
Oh, wow. So the kids at school are in for it.
Yes, they are. They'll get away with nothing this year. Gonna put the hammer down. Wilson, make sure you warn your kids.
Ryan just looked around as if kids were in the room. Like, hey, nothing. All right, we're back. 944-1070, 866-927-1070. As we continue on the Murphy Show, 934. I want to apologize officially, publicly, to Ryan Smith. He had to meet Richard Dixon a moment ago. I'm sorry for that, Ryan.
Maybe cover.
I never would have asked you if I'd known that Richard was going to do that to you. What are the kids, we look relative. I'm not asking to age yourself, but I'm 39. We're probably pretty similar in age.
Give or take 1 year, sure.
Yeah, okay. Are the kids these days that out of whack? Because I hear, I'm sitting here in the microphone, behind the microphone. I know this has nothing to do with your hearing, but I need to ask.
That's fine.
Because you experience these 10th and 11th graders, you're there. You're on ground level. You're on the front lines. Are they that out of whack? Is it that much different than back in our day? Have I become the old man that back in my day? I feel that way sometimes.
I'd say they have changed a little bit. Yeah, they're the media, their access to media, their phones have become their lifeblood. They try to do a lot of stuff that we did. Just we did it with paper notes and things like that. They can get away with stuff a whole lot faster, and they can stay a step ahead of you. What is
Mr. Smith's? What is your cell phone policy? Does the school have a cell phone policy or what?
They do. The problem is when 30 kids all have their cell phone, you can't get them all, or you'll spend your whole class doing that. So if I get my official policy over the air, it may come back to bite me.
I see. So want to keep that on the down low. I understand that. But I would think, I used to play years ago. I was obsessed with playing these trivia games where you go out at night and do trivia and you win prizes or whatever. It became an obsession of mine, and I just had to cut it off. And at the time, cell phone technology was just getting to the point where you could access the internet. When I cut it down, do you have that problem in school? Testing or whatnot, or is that as much of an issue?
If they were using it to Google answers for a test, I think I'd be a lot more lenient than I am. But that's not what it's getting used for in the schools.
in other words,
I could work with that if that's what it was being used for.
Yeah, unfortunately, they're not interested in the test. They're doing completely different things. Are you still back to the hearing thing? Is it still a matter of getting accustomed to this? You mentioned that the surgery happened in November, your first year.
Right.
And if my math's correct, that means that it was around Christmas time when you actually heard for the first time.
Yes, they actually were supposed to be activated after Christmas. I got a call from McFeely's office saying, it's Christmas. Why don't you come on in? We'll stay open late. We'll turn you on. And then we'll just make some adjustments after Christmas to make it sound better. But at least I'll have volume for Christmas. I mean, that's the type of people they are up in Huntsville. They have met me after hours. They met me in a parking garage one time just to make sure my scars were okay, make sure I was healing fine. I know that sounds kind of shady, but like I said, it was a weekend. I was passing through Huntsville, and I said, hey, will you just look at this and make sure it's healing fine? Sure. So McFeely met me somewhere, checked out, make sure I was healing okay, and then we shook hands and drove off.
Now, you have relatively short hair, and while I can notice the scar line, I don't really notice. I mean, the implant is not noticeable to me.
Right.
Is it noticeable to you?
I can't tell. Look, I'll hit it with a brush when I brush my hair because there's a small lump under the skin, but most people have no clue it's there.
And it's always with you. And I would imagine, and I don't need to tell you, you get to hear the shower, man. You've probably never heard the shower.
No, it's amazing what I can hear now. Diving into a pool sounds like a gunshot going off. It was so loud when that water hit my head. My wife makes fun of me because my biggest adjustment issue was internal noises. I didn't realize that I made noises when I bent over, and I'd kind of grunt a little bit and had no clue because I couldn't hear it. Eating chips while I'm watching TV, I have to turn the closed caption on. I can't hear anything while I chew. While I eat. It might be that way for everybody.
I think you're probably living, a little more like everybody else just nowadays. Normal, huh? It's just a normal experience. That's pretty cool. One of the memories I have from Susan Davis, who came last year.
Okay.
She said she was walking with her kid in a park, and she keeps hearing this noise, and you kind of related it with the squirrels. She said she keeps hearing this noise, and finally she turns to her child, and so I was like, "What in the heck is that?" And said, "Mom, that's a bullfrog." And she's like, and she started crying. She's like, "I'd never heard a bullfrog in my life." Right. And I'm just fascinated that you guys are getting the opportunity in the modern day to hear these sounds that maybe 20, 30 years ago you would never have been able to hear.
Had no idea they were there. This past weekend, we were down in New Orleans at my wife's parents' place, and we were on the lakefront, storms rolling in, so the flags are flapping really hard, and I can hear the flags 100 yards away popping. There's some guy on a sailboat about 50 yards away practicing his bagpipes. And that was really cool. I mean, bagpipes are good for the first 3 or 4 songs, and after that, it's kind of you want to turn it off.
Right.
But for me, not being able to hear that from that distance in the wind was just amazing. Because when you have hearing aids, you have a speaker outside your body, and everything comes from the outside. So wind just sounds like, you can't make out anything anyone's saying in the wind. Mm-hmm. You're just isolated. To be able to do that with the storm rolling in, hearing the kids playing, hear water splashing of the boats going by. It was just amazing. I just kind of got off by myself and just tried to soak it all in.
I know this is more of a psychological question than its intent, but I mean, do you turn down? Do you turn off at all? I mean, you have that ability to adjust the volume. I imagine the noise and the sound and experience, all of that is a wonderful thing and a good thing. But do you find that there are sometimes you just want some quiet?
No, it hasn't grown old yet. I turn it off with my chainsaw and the lawnmower, and that's about it.
Yeah. I bet that would be nice.
It is. Oh, you mean to turn it all the way off?
I mean, I'm not suggesting that your hearing issues over the course of the years were a benefit to you, but now, I mean, it might be not when the chainsaw's on, when the lawnmower's on, kind of to turn it down a little bit.
Turn it off. Another good time to turn it off is my wife just ran a triathlon this summer, so she was getting up about 5:30 in the morning to work out. It's nice to have it turned off then, when her alarm's going off at 5:30.
That's not bad at all.
No, that's a great feature.
Don't give my wife any ideas. She wants to turn me off at 4 o'clock in the morning. Well, look, it's such a pleasure, Ryan, and I have the benefit of talking about Envoy, and I try to only talk about those things. You listen to the show that I believe in and that I trust. And when people like you come in, I mean, I can talk to Dr. McFeely till the cows come home.
Right.
But when people like you come in, it just really solidifies in me that I'm talking about a company that can help people in the way that they say that they can help people and help folks just like you right here in the state of Alabama. So it's a wonderful thing.
Well, there's a big support network out there on Facebook, and then we just all share information. A couple hundred people are on a Facebook page. There's teachers a couple of teachers across the country that I talk to. We share ideas. We share techniques. There's a nurse down in Montgomery that's on a lot, guys up in Oxford, people all over the state who had this, who were online, all on a Facebook page. Happy to talk to anyone. I've actually been asked to call people and give them my experience before they get the implant. So the people who have this are incredibly positive, incredibly supportive. Any one of them will just walk up to you and talk to you about it. Any question you want to know, we're here.
And you seem like such a positive guy and such an asset to the teaching community.
I appreciate that.
And you told me something. I don't want to tell tales out of school, but before this happened, you were frustrated to the point you were thinking about going into something different.
I was, yeah. I was looking at corporate training. I was miserable in the classroom. It had a lot to do with the place I was at. The kids knew I couldn't hear, and they took full advantage of it. Things would said around the classroom that I wouldn't know what they were saying. They'd tell me something different happened. It made for I don't want to say a hostile work environment, but it was pretty miserable in there, knowing that I could not keep up with what was going on, and the kids were taking advantage of it.
Yeah, yeah.
This implant has given me a range of sound that I've never had before. I can pick up speech better than I ever had before. I'm really looking forward to trying both implants next week.
I was about to say, you've got 1 more week to go,
yep,
and you're back in school, and this is the first experience with both ears functioning with the implants. So, like you say, watch out, Hueytown, right?
Yeah, they're not getting away with much this year.
Oh man, it's going to be a different Mr. Smith when he comes into the classroom. Right. Look, it's been a pleasure talking with you, and come back anytime. We'd love to hear from you. And I encourage folks, if you want to find out more about Envoy Medical, just go to esteemhearing.com, esteemhearing.com, or 877-900-EARS, 877-900-EARS. You mentioned the support group. Could folks contact you that way? Is that something you want to give out from the Facebook side of things, or?
Yeah, on the Facebook page, it's run by someone else, another part of the country. It's Envoy Esteem Patients Group. You can get in, you can read the stuff. You just have to be a member to, you know how Facebook works. You have to like the page or whatever.
All right.
If people want to contact me personally, I'll be happy to leave an email address with you.
Yeah, sure.
And, I'll answer any question anybody has.
We'll get the email address off the air, and for those that maybe want to give you a shout if they have questions for you all fair on a more personal level, we can do that.
Okay.
Ryan, thanks, man.
Yeah, pleasure.